Have you ever felt a burning sensation in your chest or right at the top of your stomach after eating? Or something that just makes its way back up to your throat and leaves this bitter, burning taste? That could be acid reflux or GERD, and that's exactly what we're talking about today. Welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're covering gastroesophageal reflux disease or GERD. Stick around for questions at the end, like always, to see how much you retain. We're going to go through what GERD is, symptoms, causes, risk factors, possible complications, diagnosis, testing, and management. Okay, let's dive right in. So, what is GERD and how does it work? Acid reflux usually happens when stomach acid rises up into the esophagus. This can happen after a large meal or if you lie down too soon after eating. Most people experience this occasional acid reflux with no real issues. But when that reflux becomes chronic, happening at least twice a week for several weeks in a row, it can develop into that gastroesophageal reflux disease. Let's look at how all this is supposed to work normally. Stomach acid is only supposed to flow one way, which is down into the stomach. The stomach produces acid when food enters it, and the esophagus and throat simply aren't built to handle that acid. So when it flows the wrong way, it irritates and inflames those tissues. GERD is essentially a mechanical problem, meaning the systems that are supposed to keep the acid from flowing backward simply aren't working the way they should. Okay, let's move into symptoms here. Symptoms of GERD include a burning sensation, which is stomach acid just burning that lining of the esophagus. When this pain is felt in the chest, it is called heartburn. You might also experience coughing, wheezing, and shortness of breath, which happens if acid particles enters the airways. Other symptoms include non-cardiac chest pain, nausea, and regurgitation, meaning food comes back up and tastes off, and a sore throat, which happens when acid rises all the way up to the throat, usually at night. GERD symptoms tend to be worse at night or when laying down. They can also flare up after a large fatty meal or after drinking alcohol or smoking. Now, let's move on to causes and risk factors. GERD is caused by a weakened or overly relaxed lower esophageal sphincter, or LES for short. The LES acts as a one-way valve. It lets food into the stomach, then closes up to keep stomach contents from flowing back up into the esophagus. So anything that weakens that LES can lead to GERD. Let's look at the risk factors. Things that can weaken the LES. First, a hiatal hernia, which weakens the muscle supporting the LES, allowing stomach contents to flow upward and even become trapped in the esophagus. Pregnancy is another one. It increases abdominal pressure, which strains the muscles supporting the LES, and pregnancy hormones also cause the LES to relax. Obesity works in a similar way, also increasing that abdominal pressure. Smoking is another risk factor. It relaxes the LES and triggers coughing, which can cause the LES to open. Less common risk factors include birth defects, medications like anti-inflammatory medications, and abdominal or chest surgery. Moving on to complications of GERD. These include asthma and breathing problems, since stomach acid entering the airways can irritate existing asthma or cause asthma-like symptoms. There is also Barrett's esophagus, where the cells lining the esophagus begin to change due to long-term exposure to acid and inflammation. This is a risk factor for esophageal cancer. Another complication is esophageal stricture, where ongoing inflammation causes scar tissue to form, thereby narrowing the esophagus and causing it harder to swallow. Esophagitis is inflammation of the esophagus that can lead to ulcers. And there's also this pharyngeal reflux, which happens when acid travels up to the throat, causing swelling, hoarseness, and growths on the vocal cords. Okay, let's move to diagnosis, testing, and treatment. As with almost everything, when symptoms present, providers start with a clinical assessment, reviewing symptoms and medical history. Further testing may include an esophagram, where an x-ray of the esophagus is taken while swallowing a chalky liquid. There is also an upper endoscopy, which is a tube with a camera and light that lets the provider look directly into the esophagus. An esophageal pH test, which measures how much stomach acid is present in the esophagus. And also there is esophageal manometry, which measures muscle activity in the esophagus. For management and treatment, this focuses on lifestyle changes, medications, and possibly surgery. For lifestyle changes, this includes quitting smoking and alcohol, maintaining a healthy weight, eating smaller meals, or eating at least 2 to 3 hours before laying down, and also avoiding foods that trigger reflux. Basically, adjusting your lifestyle to reduce the risk factors we talked about earlier. For medications, antacids like Tums work to weaken or neutralize stomach acid. There is also H2 blockers like famotidine, which helps to reduce stomach acid production, and proton pump inhibitors like pantoprazole, which are usually the first-line treatment and are very effective at lowering reflux. There is baclofen, which isn't a first-line treatment, but it does help to keep the ileus from relaxing too much and letting acid flow upward. Surgery may be necessary if all other treatment options fail, and there are different surgical options that can be discussed with a care provider. Okay, now we've come to the end of the main content. Let's dive into some questions. Question 1. What is the primary mechanical cause of GERD? The answer is a weakened or overly relaxed esophageal sphincter. Question 2. Which symptom of GERD is specifically associated with acid entering the airways? The answer is coughing, wheezing, or shortness of breath. And last question. Which complication involves a change in the types of cell lining the esophagus due to a long-term acid exposure? The answer is Barrett's esophagus. Let me know how many you got right in the comments. And that brings us to the end of the video. If you found this helpful, please like and subscribe, and I'll see you in the next one.